The Salmeterol inhaler helps to control and prevent symptoms of asthma and chronic obstructive pulmonary disease. Use your Salmeterol inhaler every day to control your condition. For instructions on how to use the inhaler, please refer to the video links below. Some common side effects may include dizziness, headache, or an increased chance of experiencing throat irritation or oral fungal infection. An oral fungal infection usually presents as white patches in your mouth, hoarseness of voice, or coughing. This can be prevented by rinsing your mouth with water and spitting the water out, or brushing your teeth each time after you use your inhaler. Check the dose counter and change the inhaler once the dose counter indicates 0 doses or if the medication has expired. Salmeterol will not stop an asthma attack that has already started, as it takes a longer time for the medication to work. Thus, you should always carry a fast-acting inhaler, such as the salbutamol inhaler, that would open up your airways quickly to relieve your breathlessness during an asthma attack. Please see your healthcare professional if your asthma symptoms get worse. Signs include having to use your reliever inhaler more often than before, your wheezing or chest tightness gets worse, or your reliever inhaler doesn't help you as well as before. These symptoms may mean that your condition could be getting worse and you may need extra treatment.